talk healthcare. Back in September of 2023, Nigeria's coordinating Minister of Health and Social Welfare, Professor Mohammed Ali Pate, and the then Minister of State, Dr. Tunji Alausa, unveiled a strategic blueprint with a 4-point agenda aimed at improving healthcare delivery in Nigeria. Now, the medical and dental professionals are at the core of delivering high-quality health for all Nigerians. Fundamentally, Medical Dental Professionals Council of Nigeria fully understands its role and mandating and delivering on the renewal agenda and have defined its own strategic blueprint in connection to the healthcare initiative. So join us from our Abuja studios to discuss further is Dr. Fatima Kyari, Registrar and Managing Director of the Medical and Dental Council of Nigeria. Good morning to you. Thank you so much for joining us. So we extracted like 4 strategic plans from your blueprint, and one of them says you want to expand medical schools and produce more doctors. I'm wondering how you want to make that work, across what parts of the country this expansion will take place.
Hello, good morning. Thank you for having me here. Yes, we are in alignment with the Honorable Minister's 4-point agenda and the then Honorable Minister of State, now Minister of Education, in terms of expansion of medical schools. We have our strategic plan which aims to strategically increase the number of students intake in medical schools so that we have a net residual number of medical doctors and dentists that remain. So as the Medical and Dental Council of Nigeria, we are responsible for education and training of doctors and who gets onto our register. We are also keying into the High Impact TED Fund project of the Federal Ministry of Education for infrastructural development that would support these. So there are 4 strategic points that we look at in the expansion. One is infrastructural development, the other is human resources capacity and improvement. The third one is effective delivery of curriculum. And of course, we're also looking at quality improvement in terms of how we follow the students. And our aim is to follow the students right from inception as students up to how they become doctors, and then we can, strategically support them as the workforce grows.
All right, so that makes sense. I mean, and it's a well thought out strategy. It's a grassroots thing. You want to groom them, train them. But your report points to a scarcity in terms of the doctor-patient ratio. I think we've got a couple quotes from there. I mean, one says currently Nigeria has 23 medical doctors per. I thought that was a typo. Per 100,000 people. Far short of the World Health Organization guideline of 100 medical doctors per 100,000. And then you said, your report says, with the current output of doctors in Nigeria, it would take 100 years to achieve the recommended doctor-people ratio. So, considering how long it takes for a medical student to take the MCATs and all these other exams, local, international, and also for dental as well, to get qualified, have you considered, attracting doctors from neighboring countries to work in Nigeria to close the gap?
Well, yes. If you look at the numbers, it's like we're racing against the tide. The more we increase, the more the requirement, because the population is also growing. And we need to catch up with the number of doctors with the growing population to meet up with the WHO recommendation of the number of doctors to a certain number of populations. We do welcome any doctor that wishes to join us. We have mechanisms on how we register doctors that have not been trained in Nigeria, and anyone is welcome. But our main aim really is to increase the medical education pipeline so that we can have sustainable local capacity. And as I mentioned before, in previous forum, we want to increase more doctors being produced in Nigeria to service the local needs, and even as well as, possibly allow them to, if they want to emigrate, it still becomes a net increase in number rather than a deficit.
Makes sense. Speaking of that deficit, the brain drain is not news to anyone here in Nigeria, and that unfortunately has contributed to that low doctor-patient ratio that was pointed out in your report. So how do you reduce that brain drain? Is it down to simply paying doctors higher wages in the public sector?
It's not really about wages. Brain drain is really a topical issue. And discussing the health workforce mobility is actually a focus of our discussion. We have an ongoing capacity building workshop, which was convened by the Association of Medical Councils of Africa. And we have several councils from Africa, about 15 to 22 of them, who have convened. And one of the issues that we're talking about is this workforce migration. So it is a topical issue, but it's also a complex thing. It's not just about wages. There are other things that we look at, job satisfaction, the infrastructure in the hospitals where these doctors work, their social welfare, even including jobs for their spouses, school for their children. These are all the issues that we really look at. So it's not just about wages. And, I really want to appreciate the way that the National Health Sector Renewal Investment Initiative is going on, because we're looking at infrastructure development in these hospitals. I mean, we always say that our doctors are very well trained. If you give them the tools, the resources, and the clinical sites to execute the work that they know, then there will be better retention capacity, and also their career progression and increasing their professional status. So these are some of the things that we really look at, not just about wages in terms of brain drain. We're also looking at diaspora engagement, reintegration of those who have left. So there are a few parameters that we're looking at, like we have the SCALE program, which was initiated by Association of Doctors who are working outside the country in terms of executing clinical excellence or improving our clinical excellence. So quality improvement is also a thing that we're looking at to enhance retention of doctors who remain.
Now, forgive me for beating down on wages. All right, your point is well made. But I mean, if you look at the private sector, right, on the private side of the medical sector, they charge higher for their services because, I mean, their doctors are paid higher, right? You talked about investments in infrastructure and so on. Taking a holistic view, all right, of the medical sector at large, is there an eye towards boosting more private sector investments in the medical sector? Because as you said, we've got some incredible doctors here, and I've seen them myself in the private sector and public sector. But what about the, boosting private sector investment to try to help what you're trying to do?
Yes, well, MDCN, aligns with national and sub-national interventions under the National Health Sector Renewal Investment Initiatives. And that is what really addresses, the interaction between the public-private partnerships and programs of engagement of other key stakeholders. So we do align with them. And I think what we need to do, or as a sector-wide approach, which is the minister's approach, is to de-risk investment of the private sector in terms of tax breaks, perhaps, accessible, affordable credit, giving them loans with the Bank of Industry and the likes, and then allocations of land for hospitals, which has already happened. We have an example here in Abuja, which is a big multinational partnership with new hospitals, increased infrastructure, and public-private partnerships. So going that way, then we can have encouragement for private investors, and also we can give them that sense of satisfaction and also confidence, because really private sector engagement in health takes off a lot of the strain in government. Some statistics even show that about 60% of health care is provided by the private sector. So they are really very key in terms of engagement in the private sector, in the health sector.
All right.
But as MDCN, we must ensure that we regulate and maintain equity and ethical standards in whatever we do.
Makes sense. Now, final question for you. This is my favorite part. I love that your report talked about technology, part of the improving the core functions of the MDCM. You talked about digitization. And Dr. Kyari, I'll tell you, if I go to a hospital, I don't want to give them my name so they can pull up my data. They should be able to scan my eyeball or take my fingerprint and my data pops up on the computer. And that's how it should be everywhere. So can you talk to us about the digitization efforts across the board and how you plan to scale them as far as the public sector medical side is concerned?
Well, that's also my dream, just what you said, scan the iris, which is also a distinct, unique feature in everyone's body, just like the fingerprint. But this is, again, a really important thing. And in the workshop that we're having, we have a whole session that talks about credentialing, credentialing systems. So digitalizing our credentialing systems in the Medical and Dental Council, the registration. And then also digitizing our records, in the health system. But the digitization of health records really, is not under the purview of the Medical and Dental Council, but we are in alignment with the Ministry of Health because we have a digital health initiative as well and electronic medical records. So these are all things that are in alignment. But what this does is that it smoothens credentialing systems and registration systems. It also enhances ability for us to know who is doing what at what time. It reduces fraud. So in the Medical and Dental Council, for example, one can go online and register as a doctor and follow up their registration and upgrade and even renew as a doctor. So we want to optimize these facilities right now. And we are monitoring, we want to monitor, we want to use those records to monitor health workforce mobility, which is also, that will help us to enable data-driven planning. So these are real-time things that we would really like to do, and we are working on it. At the workshop, again, we have collaborations with the NG-CERT and other regulatory bodies that deal with data. So we're going to be talking about data security, cyber security, so that our doctors, our patients whose data are captured will feel confident that their data is secure. Those are some of the things that we're looking at. We're not only going to improve our own delivery systems, our own mechanisms to be more efficient, but we also want to boost the confidence of the public and the confidence of our doctors who we hold their data with us.
Fantastic. Look, great conversation. This administration is taking healthcare seriously. The budget is higher, the allocations and so on. And we wish you the best of luck. We're going to have you back on the show in the future to talk about the improvements that have been made across the sector. Thank you so much for your time, Dr. Fatima Kyari, Registrar, Managing Director, Medical Dental Council of Nigeria.